Almost 300 classes were canceled in Taipei and New Taipei last week due to enterovirus infections. Over the same period, more than 17,000 medical visits were made for enterovirus symptoms, marking the second highest figure in nearly a decade. The CDC and Ministry of Education have launched a public health campaign at schools to reinforce good hygiene habits.
Enterovirus is sweeping Taiwan. Over the past 2 weeks, 227 classes were cancelled in Taipei and 63 in New Taipei. The CDC and Education Ministry have launched a school campaign to promote enterovirus prevention.
We haven't had any enterovirus cases in the past 2 weeks, but there have been students with fevers and cold symptoms due to recent weather changes. At school, we make sure the children wash their hands properly.
According to the CDC, symptoms of a potential enterovirus infection in children include confusion, reduced activity, and drowsiness. The virus is highly contagious and can easily spread among siblings. Households with children 5 and under should be particularly careful.
Last week, we added 1 case of severe enterovirus infection. In total, there were more than 17,000 medical visits for enterovirus symptoms. That's the second highest figure for the same period in nearly 10 years. During the COVID pandemic, most people wore face masks and everyone paid a lot of attention to hand hygiene. Now, in the post-pandemic era, we urge children and parents to practice hand hygiene and cough etiquette.
Currently, Group A Coxsackie viruses account for most of Taiwan's infections. Enterovirus types A71 and D68, which tend to cause more severe symptoms, have only been detected in isolated clusters, but experts urge the public to stay cautious.